Hey, this is Tony. Welcome back to our next discussion on the drug medications for poisonings and toxins. This is going to be drug exam number 10. So, we're going to talk about some additional medications that are carried for different types of poisonings and exposures. Now, I'm going to be brutally honest here. A lot of these medications that we're going to talk about today are not something we carry on the ambulances locally. They are very specialized things, and some of these medications are kind of almost obscure, I would say. But the first one we're going to talk about is atropine. We should be very familiar with atropine. We know that it's a cardiac drug as well. But in this situation, we're going to use it for organophosphate poisonings. Now, what is an organophosphate poisoning? Organophosphates are chemicals like pesticides, herbicides that farmers use to make their yields more or better, higher yields in the farming industry. And we can be exposed to them. Also, large exposures to like RAID or anything that is like herbicide or herbicide or pesticide can cause organophosphate problems. Now, organophosphates work by binding with acetylcholine terase and breaking it down. So there, and remember that acetylcholine terase goes through in that synapse and breaks down acetylcholine. So when we have an organophosphate poisoning, we have too much acetylcholine in that synapse. Now, there are some very specific signs and symptoms for organophosphates, and we use the acronym SLUDGE, and that goes as follows. Salivation, S, salivation, the patient will be drooling. Lacrimation, that means that's the fancy way of saying that people will have teary eyes. Urination, frequent urinations are something that we see. Diaphoresis and defecation are other signs and symptoms that we see with organophosphate poisonings. GI problems as well, and then our favorite, emesis. And so those are all signs of organophosphate poisonings. Now, normally when we use atropine, we use it to increase the heart rate during bradycardias, and we just use 1 milligram in that situation. Organophosphate poisonings are very hard to overcome, so we have to use high doses of atropine to overcome those problems. So the dose for atropine in an organophosphate poisoning is 2 to 4 milligrams, or sometimes even more. Now, the organophosphates can be used in war as a chemical agent, and soldiers will sometimes carry auto-injectors with atropine in them if they become exposed to organophosphates. And the onset for atropine in this situation is immediate, just so we remember that. Next, what we're going to talk about is calcium gluconate. Calcium gluconate we can use for several different things. We can use it for hyperkalemia, hypocalcemia, hypermagnesemia, and but in this situation, we're talking about using it as a beta blocker and calcium channel blocker overdose. And it's not something that we use very often, but it can help reverse the effects of those problems. Typically, the dose is 1.5 to 3 grams given over 5 minutes. The next medication we're going to talk about is glucagon. Remember, we use glucagon for several things. When I was first in EMT, I worked in an ER, and we gave glucagon for food boluses. And what a food bolus is when you swallow and it gets stuck in your esophagus and you can't swallow, and it's very uncomfortable. It's not necessarily a life-threatening condition, but it It's very uncomfortable, and we saw it quite frequently. So we would give glucagon in that situation because it increased salivation, and it would kind of lube up the esophagus and make that food bolus pass on down into the stomach. But that's not what we use it for in emergency settings at all. We use it for beta and calcium channel blocker overdoses. Typically, the dose is 5 milligrams given IV, and the big contraindication for glucagon is for a patient with hyperglycemia or high blood sugar. Now, how does glucagon work, remember, and why is that important? Typically, we use glucagon to raise blood sugar in patients where we don't have the ability to establish an IV. And how glucagon works is it converts glycogen that is stored in the liver into glucose. So the body can then use that glucose for metabolism. But in this situation, we would be giving it for a calcium channel blocker and a beta blocker overdose. The next one we're going to talk about potassium. Potassium is a very powerful medication that we can sometimes carry. It's sometimes called Pima syrup, and the dosage is we need to contact medical control for that. This is not a medication that is typically carried on your everyday ambulance service. So it's something that needs to be monitored very closely. And typically it's given for radioactive iodine poisonings. 2-PAM is the next medication we're going to talk about. And 2-PAM is also called paralidoxime, and it is also for organophosphate poisonings. And it works in a similar way to the way the atropine works. It blocks that acetylcholine terase from being taken, and we don't have the same problems that we would with an organophosphate poisoning. Usually it's carried in an auto injector like an EpiPen, but it is specifically for organophosphate poisonings. And in normal situations, those auto injectors hold 600 milligrams. So the dosage for that would be a 600 milligrams IV. No, that's wrong. 600 milligrams auto injector. The last medication we're going to talk about is sodium bicarb. Now, we've heard sodium bicarb before, and it is given for a lot of different things. And ultimately, what sodium bicarb does is it kind of works in the same way that our metabolic system, our renal system, works to reverse acidosis. And it raises the pH in the body by binding with hydrogen ions. We give it for tricyclic antidepressant overdoses, and typically the dose is 1 milliequivalent per kilogram in a given solely through IV. And not something we do very often at all, but it can be used for that. That's all we have for today. Please feel free to ask your instructor if you have any questions, and good luck on drug exam number 10.